Hello, I'm Dr. Andrew Van Treese, and I authored the book, How to Be a Winner, a Lifestyle Guide to Achieving and Maintaining Health. I practice brain-based therapy, and today I'd like to talk to you about migraine headaches. 28 million Americans suffer with migraine headaches, of which there are two types, the classical and the common. Now with the classical, the headache is preceded by what's called an aura. And this aura is going to be flashes of light or squiggly lines or what's called a halo effect. In the common migraine, there is no aura. These headaches occur at a ratio of 3 to 1, with the common being more prevalent. Now we used to simply think that the migraine headache was enlarged blood vessels within the brain. But current research shows us that it's a rapid constriction and dilation of these blood vessels due to excited neuron activity, which causes irritation to the nerve mesh which surrounds these arteries. Now, there's something which is called cortical spreading depression. This is prior to the onset of the headache. And this is a sudden burst of cortical activity, most common in the occipital lobe at the back of the brain, which is then followed by severe depressed activity. Now this is important because the normal brain loop is that the cerebellum talks to the cortex. 90% of the cortical output then talks to the lower brainstem, which suppresses upper brainstem activity. If the mesencephalon is allowed to be overstimulated and overactivate due to loss of that loop, then you're going to experience migraine headaches. Now, if you're a migraine sufferer, you've probably gone through the typical treatment, which is a Russian roulette of medications, Imitrex, Topamax, the list goes on. And maybe these even worked for you for a short time, but then the headaches came back. And that's because the brain habituates to all stimuli, gets used to it. Until we actually fix the brain, the problem's not going to go away. And that's where brain-based therapy comes in. With BBT, we're going to do a complete neurological examination to determine which part of the nervous system is not functioning properly, and then we're going to treat it. We're going to treat the cause, which eradicates your headaches. We do this with fuel and activation. Fuel comes in the form of oxygen that we give at our office, and then we also do therapy to activate those regions of the brain. So I encourage you to watch the introduction to the BBT video on the home page of our website. There you're going to hear more about BBT and the therapies we use to increase activation to dysfunctional regions of the brain. I look forward to working with you, and I look forward to the life that you deserve to live by eliminating your migraine headaches. Thank you.